Good evening, ladies and gentlemen. Tonight I'd like to talk to you about childhood obesity and why it needs to be prevented. Obesity is simply weighing over the deemed amount versus your height. It can simply be measured by your BMI, or body mass index. People who have excess body fat and who are considered to be obese have a higher chance for health problems. Did you know that 61.2% of adults in America are obese? 27% of them are children. In Texas, approximately 1.1 million children are considered to be obese. All of them are young children up to adolescent age 2 to 18. Problems of childhood obesity can result in orthopedic problems. Young bone structure is not made to handle excess weight. Your body frame is only deemed adequate to hold so much weight. Shin splints are more common in obese children because of excess weight. On average, doctors in the United States saw 1,003 more patients in obese children with shin splints than they did in 2011. Osteoporosis, which is a bone disorder most common in the elderly, is usually at around 3%, 4% in children. Since 2010, it has gone up to 25%. Of that 25%, 21% are children that are obese. Osteoporosis breaks down your bones, which is another reason why your bones are not designed to hold the excess weight. Society plays a large role in childhood obesity. Advertisements all over our roads, stores, advertise things that are not always healthy examples of what children should be putting into their body. Low physical activity. Children's nowadays, they spend about 4.5 to 5.5 hours a day either watching television or playing video games. They don't get up and move around and exercise, and the low exercise in return can lead to obesity issues in children. Children are also less involved in school activities. Nowadays, children worry about what other people think. Some children may not can afford to be in extracurricular activities. They may not have a ride. There's just various different reasons as to why children are not involved, but they are not involved in as many after-school activities. Poor eating habits. Eating at home, you have single-parent households more every day, or parents that both have to work. When both parents have to work, your meals get less healthy. They're more snacks instead of actual meals. 1 out of every 3 families can admit that they do not sit down and eat any one meal with their children at any given time. It's not uncommon for a single-parent household to have to work to provide bare minimum necessities. Healthier choice foods are more expensive than other stuff that has more byproduct and not as healthy. Parents can barely afford to pay bills, let alone buy healthier foods. Another issue is when meals are cooked at home. They're quick. They're microwave foods. They're sometimes often cooked in grease or vegetable oil. It cooks faster, and that's what the kids like. Instead, try using something different. Bake it. If you bake a chicken thigh and leg versus deep frying it, you're cutting out about 47% fat. The rise in medical costs is another concern in childhood obesity. Healthcare industry has affected millions of dollars to cover medical issues and government-funded medical. USAA policyholders said in the last 6 years, insurance premiums have nearly tripled. Parents are paying $84 a month more for child's insurance for an obese child. Taxes are being raised to pay for Medicare, Medicaid for obese children. Hospital care has doubled in the past 3 years. Baptist Hospital in Maryland saw an increase in care from 2004 to 2011, specific to disorders ranging in obese children. In 2004, they saw 6,800 obese children. In 2012, that number jumped to 16,300. The cost of care and procedures has also significantly increased. Doctors are paid on average $15,000 more a year for patient loads of having to see kids, more and more children coming in with obesity and their issues. There's simple fixes to this. Talk to your kids, but you can lead by example. That's the most important. And I fully believe that in 10 years, childhood obesity will be at a lower level than it is now. Thank you.